to President Rodrigo Roa Duterte, Senator Bongo, and to those belonging to the Cabinet of the Philippines, and also to the public. Good day to all of you. I'm Raie Kirsten Castañarez, and along with my members, we would like to present our health program entitled Dengue Prevention and Control Program, wherein, as the name suggests, it focuses on how to prevent and control dengue, which is a kind of mosquito-borne viral infection that is found in tropical and subtropical climates worldwide, that occurs mostly in urban and semi-urban areas. In today's presentation, we would like to widen your knowledge about the health program by providing information that includes the authors of the said program, the heads, the mission vision goals, the timeline, as well as the beneficiaries, setbacks encountered and how they were remedied, and lastly, our feedback about the health program and a YouTube video regarding the health program. Let me start off with the authors. In the year 1993, the Communicable Disease Control Service, as mandated by Executive Order 119, reorganizing the Ministry of Health, its attached agencies, and for other purposes, had formulated the National Dengue Prevention and Control Program for the control of DF, dengue fever, or DHF, dengue hemorrhagic fever. Dengue fever sometimes turns into dengue hemorrhagic fever, which is a more severe and fatal form of the disease. Immediate attention must be given to the patient, and that is the same reason why this health program is necessary for all of us. Now, let's proceed to the heads of the health program. The one who is spearheaded, or the one who is responsible for the dengue prevention and control program, is no other than the DOH, or also known as the Department of Health. The Department of Health is the executive department of the government of the Philippines, responsible for ensuring access to basic public health services by all Filipinos through the provision of quality health care, the regulation of the health services and products. Anything that is related to health of the Filipino people, DOH always gets involved because that is their primary task. Next is the mission, vision, goals of Dengue Prevention and Control Program. Let's start off with the mission of the health program, and that is to ensure healthy lives and promote well-being for all at all ages. Healthy lives and promoting well-being are truly a mission, I might say, because dengue is one of the life-threatening viruses that exist here in the Philippines. This is somewhat applicable to the saying, small but terrible, because a small mosquito could bring such a disease. The vision of the health program is a dengue-free Philippines. There are various ways or measures to be done that would be able to contribute to the vision of the health program, and one of which is the use of spray, or truck spraying, which treat areas in order to kill the mosquitoes. The goals and objectives of the program is to reduce the burden of dengue disease. Dengue disease is a problem that we've been dealing for a long period of time. We can't eliminate it in a flick of a finger, but we can reduce the burden that it brings. In addition, here are the objectives with its corresponding formula and computations. First is to reduce dengue morbidity by at least 25% by 2022. Morbidity refers to the condition of suffering from a disease or medical condition. In this case, it is dengue. Morbidity rate is equal to the number of suspect, probable, and confirmed cases multiplied by 100,000 over the total population. Baseline is 198.1 per 100,000 population. 2015 data is 200,145 divided by 100,981,437 multiplied by 100,000. Second is to reduce dengue mortality by at least 50% by 2022. Mortality refers to the state of being subject to death. Mortality rate is equal to the number of dengue, probable, and confirmed deaths multiplied by 100,000 over the total population. The baseline is 0.59 per 100,000 population, and the 2015 data is 598 divided by 100,981.437 multiplied by 100,100. And lastly is to maintain case fatality rate, CFR, to less than 1% every year. Case fatality rate, also called case fatality risk or case fatality ratio, in epidemiology, the proportion of people who die from a specific disease among all individuals diagnosed with the disease over a certain period of time. CFR is equal to the number of dengue probable and confirmed deaths multiplied by 100 over the number of probable and confirmed cases.
Good day again to President Duterte, Senator Bongo, and to those belonging to the Cabinet of the Philippines, and also to the public. I am Rosemarie Cruz, and I will be discussing the timeline and major developments of the Dengue Prevention and Control Program of DOH. The first major development was launched in December 1996, and it is called Tepok Lamok Dengue Sapok, or Kill the Mosquito, Knock Out Dengue, 4 o'clock habit. It is a special program collaboration between GO and NGO. As per an administrative order of the former President Mr. Fidel V. Ramos, all government and private agencies and the citizenry are required to observe the 4 o'clock habit, whereby every 4 o'clock in the afternoon, everyone must search and destroy or eliminate breeding places of mosquitoes in homes, offices, and the environment. This 4 o'clock habit can be practiced at one's convenience if necessary. The second major development was launched on July 22, 2010, and it is called Intensify Dengue Information Campaign through radio plugging and newsprint publication on 4S Laban sa Dengue. This 4S strategy consists of search and destroy mosquito breeding places, secure self-protection, seek early consultation, and support fogging or spraying only in hotspot areas where an increase in cases is registered for 2 consecutive weeks to prevent an impending outbreak. Its goal is to prevent dengue that starts within ourselves by maintaining cleanliness in our surroundings, by emptying containers of stagnant waters to eliminate breeding places of Aedes aegypti mosquitoes. The third major development was launched on July 19, 2011, and it is called Search and Destroy Activities in Schools, or Ronda Escuela. The Department of Education issued this memorandum emphasizing the urgency of the anti-dengue drive, particularly in schools, where school children become most vulnerable. This is in support of the national campaign led by the Department of Health, conducted regularly during the rainy season in all public schools nationwide. The fourth major development was launched on April 2016, and it is called a School-Based Dengue-Free Zone Project Expansion. This is where the DOH announced that they would be launching a program that would bring the world's first ever dengue vaccine to the Philippines. The DOH announced that it will be a school-based immunization program of Sanofi Pasteur's Dengvaxia vaccine. The fifth major development was launched on January 9, 2018, and it is called Distribution of Dengue IEC Materials both for public and private schools. The Department of Health National Capital Regional Office has primarily coordinated with all local government units, city health officers, in the Department of Education, school superintendents in disseminating accurate information regarding the dengue immunization program, and at the same time, further intensifying the control and prevention strategies against the virus. The District 3 LGU had already started distributing IEC materials such as tarpaulins and posters to schools, particularly those who participated in the said immunization program. These were placed in strategic locations such as gates, canteens, guidance counselor offices, and classrooms of grade 5 and 6 students who were most likely to have been participants of the dengue immunization program 2 years prior. The last major development was launched on June 15, 2021. It is the ASEAN Dengue Day Regional Forum in observance of the National Dengue Awareness Month with the theme ASEAN Unite Against Dengue Amidst the COVID-19 Pandemic. Proclamation number 1204, Series 1998, declares the month of June as the National Dengue Awareness Month. The Philippines was identified as the lead country for the celebration of the ASEAN Dengue Day. Participants shared their best practices in the prevention and control of dengue within the region amidst the COVID-19 pandemic during the ASEAN Dengue Day Regional Forum. Next, we would proceed with the beneficiaries. The beneficiaries of the Dengue Prevention and Control Program of DOH are the patients, children, teenagers, PWD, healthcare workers, and elderly. Because dengue is known to be transmitted primarily by mosquito vector Aedes aegypti, and it may affect everyone and can have serious consequences for individuals who are vulnerable to the viral infection.
Good day to all of you. I am Krizzia Talens and I will be discussing the setbacks that the Dengue Prevention and Control Program encountered and how they were remedied. First off, let me explain to you the definition of dengue. Dengue is a viral infection that occurs in tropical and subtropical climates and is currently the world's fastest spreading mosquito-borne disease. It causes flu-like symptoms and can be life-threatening, particularly in children if the disease progresses to a more severe form. A vaccine was developed to help prevent dengue fever, which was called Dengvaxia. It was introduced in April 2016 in the Philippines, where it was administered to over 800,000 children as a part of a school-based campaign. However, by the year 2018, the Philippine government had halted the campaign, expressing concern about the vaccine's effect on people who had never had the disease. Within a few months, the potential implication of the vaccination drive had become a national scandal, with pharmaceutical companies and health department officials alike being held liable. Allegations surfaced that the vaccine was responsible for the deaths of several children, and the Philippine Public Attorney's Office filed a lawsuit against government officials, Sanofi executives, and Swedish Pharma in February. The lawsuit sought damages after a 10-year-old girl died following vaccination despite having a pre-existing condition. While Dengvaxia's use was suspended following Sanofi's November 2017 update, its long-term future remained questionable until February 2019, when the Philippines Food and Drug Administration permanently revoked the vaccine's license. The regulator's Director General, Nela Puno, stated that the decision was made due to Sanofi's failure to adhere to post-marketing commitments. Meanwhile, the Dengvaxia issue was the subject of 2 congressional investigations and a criminal investigation at this point. The Department of Justice announced in March that it had gathered sufficient evidence to charge both Sanofi employees and Philippine health officials, including former Health Minister Janet Garin. The department contended that the named defendant overlooked the vaccine's known risks and adverse effects and are therefore responsible for the subsequent deaths. While a panel of medical specialists is gathering information about the alleged link, no conclusive evidence linking the deaths to Dengvaxia has presented to date.
Now we are down at the last 2 parts of our presentation, our feedbacks and the YouTube video. Here are our feedbacks about the health program. The health program entitled Dengue Prevention and Control Program is very necessary, especially because having dengue is hard to handle. Your body becomes weak and it can also trigger your emotional response. That's why immediate attention to it is a must. Also, the program's vision, mission, and goals are really on point.
Dengue has been an issue in the Philippines since 1953, and it's great to have a program in place to help us lower dengue infections, morbidity, and mortality rates to the point where it's no longer a public health concern.
Since dengue is considered as the fastest spreading vector-borne disease, the Dengue Prevention Program can help us to be aware and have the knowledge on how we can protect ourselves as well as our families from the dengue virus. The dengue virus can also be fatal. That is why we need to know the most effective measure in dengue prevention and control. To further discuss the importance of having a dengue prevention and control program, I will be presenting a YouTube video about dengue awareness from the Department of Health.
Following. First is the epidemiological data of dengue in the Philippines. Second would be the comparison between morbidity week 15. So that is 2020 versus 2021. The Philippine data trends on cumulative number of dengue morbidities and mortalities. The current dengue strategies during the COVID-19 pandemic. The promising innovations and best practices, key lessons learned, and our take-home message for community engagement. So for the epidemiological data, starting from 2018, the dengue morbidities and mortalities have greatly fluctuated. However, on August 6, 2019, the national dengue epidemic was declared in the country, wherein there is a spike in cases leading to a cumulative number of 437,563 morbidities and 1,689 reported deaths. In 2020, we had an 81% decrease in the number of cases compared to the last year, numbering to 83,335 cases with 324 deaths. This may be attributed to the implementation of the enhanced 4S strategies, namely search and destroy mosquito breeding sites, self-protection, seek early consultation, and support fogging or spraying only in hotspot areas where decrease in cases is registered for 2 consecutive weeks to prevent an impending outbreak that have been strengthened in every household, especially when we are placed under community quarantine, wherein most of the people stays at home, which could have also led to a better water sanitation hygiene or wash practices, thus decrease the mosquito breeding grounds. For 2021, as of morbidity week 15, that is until April 17 of this year, we remain hopeful that a decrease in cases would continue, and of course, this must be partnered with an integrated vector control management and other prevention and control activities. So in order to see if there is a definite decrease of morbidities and mortalities from the previous years, we have compared the data from the same period, which covers morbidity week 15, cumulative data from January 1 to April 17 of 2020 and 2021. As you can see, there is a 56% decrease in morbidities and 55% decrease in deaths. For the data trends on cumulative number of dengue morbidities, we would like to show the current data trends on how they differed over the years. So as I've said earlier, we had an epidemic last 2019, so we can see a sharp increase here in 2019. So the same pattern can be observed for the mortalities. This slide shows the data trends on dengue case fatality rates. So as you can see, we were able to achieve our target of maintaining the case fatality rate of dengue at less than 1%. However, we recognize that we fell short in meeting the second condition or criteria of the target, which is to reduce the case fatality rate by 0.1% annually. Hence, we deem that we need to review and update the dengue clinical case management in order to fully obtain the annual target. As to the current dengue strategy amidst COVID-19 pandemic, we have heavily shifted to the digital platform. In line with this, the program has been making use of the digital age to distribute advisories to our regional offices or the Centers for Health Development for guidance and requested actions. Images flashed on our screens are the series of advisories on dengue infection relative to COVID-19 disease, such as the reiteration of the 4S strategies and guidance on anticipated outbreaks, among others, that have been released during the COVID-19 pandemic.
And that's all. Thank you for listening to our presentation.
Raie Kirsten H. Castañarez Rosemarie A. Cruz Krizzia Talens